Hello, so great to be here at IVF Babel. My name is Serena H Chen. I'm a physician. I do reproductive medicine, in vitro fertilization, egg freezing, all those kinds of things in the United States and New Jersey. And I'm here to talk with you about the COVID-19 vaccine. So right now in the United States, we have two vaccines that have been approved, and those are both messenger RNA vaccines. They are under emergency use authorization by the FDA, so it's not full FDA approval, but the FDA feels that during the pandemic, there's enough data to feel that these vaccines are effective and safe. They're both messenger RNA, but you know, if you're here at IVF Babel, you're probably thinking about your eggs, your sperm, you're thinking about your fertility. You might be pregnant. And all of those are concerns when it comes to new medications and things like that. So I did want to talk with you about that. And there's recently been a lot of kind of controversy and confusion because the WHO came out with a statement in January saying maybe not all pregnant women should get the vaccine, but in the United States, all of our societies and authorities and experts are actually on the same page. Our CDC, the FDA, our advisory committee on immunizations to the CDC, ACIP, and then all of our women's health experts, the American College of OBGYN, ACOG, the Society for Maternal Fetal Medicine, SMFM, and the American Society for Reproductive Medicine. That's people like me, all the in vitro fertilization doctors across the country, all very strongly have been on the same page since, you know, back in December when these vaccines got emergency use authorization, that given the pandemic and the risks of COVID-19, it seems that for the messenger RNA vaccines, that the benefits of getting vaccinated far outweigh the risks of getting vaccinated and any theoretic risks. Now, why is that? So first of all, the messenger RNA vaccines, the one by Pfizer and the vaccine by Moderna, those are both approved in the United States. They are both messenger RNA vaccines, so they're actually quite similar. They're a little segment of messenger RNA, which is code to help your cells make protein. It's packaged in a little lipid package, and it's put in an injection, and it's injected into your deltoid muscle. So when you get this injection, the lipid allows the lipid particles attach to the cells, and it just merge with the cells, and that allows delivery of the messenger RNA into your cells. Now, the messenger RNA is a code, and your cells are a little factory. They're essentially protein factories. So as soon as like a piece of messenger RNA comes in, the pieces of the factory all gather together around the messenger RNA, and that is ribosomes and transfer RNA, and they put the code together and they make protein. And in the case of these vaccines, they're making a piece of the spike protein of the coronavirus. So it's not the whole virus. This is not live virus. It's not attenuated virus. It's not killed virus. There are some vaccines that are being developed that are like that, but this is only messenger RNA. So it codes for a little piece of the spike protein. The spike protein is what the coronavirus uses to attach to the lung cells and other cells in your body that allows the virus to get inside your body and cause a big infection. So this is only a very small part of the coronavirus spike protein. So the messenger RNA goes into your cells. It goes into your cytoplasm only. It does not go into the nucleus. It does not change your DNA or your genetics. your cells make this piece of protein. This protein then gets presented by your cells to the rest of the body, and your immune system recognizes the spike protein as not human, as foreign, and then your immune system activates, and you activate B cells and T cells, and the B cells make antibody against the spike protein, and apparently they make all different kinds of antibodies, like multiple different kinds of antibodies, and then T cells are also activated to do their kind of thing. Now I have to say, I don't understand that part very well. I'm a vagina doctor, okay, reproductive endocrinologist, trained in OBGYN. I am not a virologist, but I know T cells also are responsible for immunity. T cells are not talked about so much because T cell immunity is very difficult to measure, so we don't actually know a ton about it. But we do know these vaccines are extremely effective in their trials, and that's part of why they were approved. And they also seem to have a very good safety profile, both of them. So what about pregnant women? Well, American College of OBGYN fought very, very hard to try to get pregnant women into the trial, and just like a lot of other things in women's health care, we didn't really get what we wanted. Unfortunately, pregnant women were excluded from the trials, and that kind of leaves us in this weird catch-22 where, we're excluded from the trials. So people say, well, we don't have any data in pregnant women. Well, there's like no way to get data because we're excluded from the trials. So anyway, ACOG and ASRM and the CDC and the FDA and ACIP all are on the same page because they know we have the known risks. So even though we don't have a study in pregnant women saying that the vaccine is safe, we do know a lot about the physiology of pregnancy. We know a lot about the physiology of our bodies. We know a lot about the physiology of messenger RNA, and we have pregnancy trials in animals. And all of those things have so far been very reassuring, and we don't think it's likely at all that there's gonna be some crazy issues with the vaccine. Now, having said that, we have to put this all in context because it's always about a risk-benefit ratio. So the risks of not getting the vaccine are huge. We're in a pandemic. The virus is mutating like wildfire. People are getting infected. Thousands, tens of thousands, hundreds of thousands of people getting infected every day all around the world. People are dying, and pregnant women especially should be normally young and healthy. We're in the young and healthy group, and those should be low risk for dying from COVID, while pregnancy takes you from a low risk group and puts you automatically into a high risk group. Pregnant women are at much higher risk of getting severe COVID. They're much higher risk of ending up in the hospital. They're much higher risk of ending up intubated on a ventilator. They are at much higher risk of dying. And so knowing that for certain that COVID is spreading like crazy around the world, that we have a global pandemic, and that people are dying, including pregnant women, every day. And we know pregnancy puts you at great risk for COVID. All the American experts and societies all agree that the benefits of the vaccine for pregnant women, women trying to conceive, and women lactating, and men trying to conceive far outweighs the risk, the theoretic risk of the vaccine. We are collecting data on pregnant women. So the CDC, through their new vSafe app, has already, there's already been tens of thousands of pregnant women, over 10,000 pregnant women, maybe like close to 20,000, hopefully soon, have been vaccinated with the messenger RNA vaccines. And so we will have significant data soon. So far, nothing crazy has happened, but obviously we're going to track it. So talk to your doctor. ACOG and the CDC and the FDA and ASRM are not saying you have to get the vaccine, but they are saying pregnant women should not be restricted from access to the vaccine. So if it's time for you to get the vaccine and you're pregnant or you're trying to conceive and you want to get it, you should not be prevented from getting it just because you're pregnant. And women should not have to take a pregnancy test before they get the vaccine. That's very strong wording from them. Now, the WHO was kind of a little waffly last week about it. They were saying, oh, only women. They were very confusing because they said only pregnant women at high risk should get the vaccine. And then they said only healthcare workers. Well, obviously there are a lot of other women other than healthcare workers who are at high risk of getting COVID-19. And in fact, since pregnancy itself makes you high risk from dying from COVID-19, doesn't that kind of make all pregnant women high risk? So there was a huge outcry all around the world because the WHO was super confusing and everybody was confused, and it created more vaccine hesitancy really at a time when that's the last thing that we need. We need people to feel comfortable taking the vaccine because that is our way out of this pandemic. A lot of the mutations are rising because the virus is spreading so rapidly. This virus does not actually mutate at a rate as fast as the flu, but because so many millions of people are infected, every time the virus infects another person, it's another mechanism for the virus to mutate. So we're seeing all these variants, and these variants potentially are a huge risk. So we really need to try to get as many people vaccinated as we possibly can, including pregnant women. Now, if you don't want to get the vaccine, you don't have to. But I would say that if you're at risk of getting COVID-19, if you cannot completely and totally shelter in place and prevent contact with anybody who might have COVID-19, and you have a chance to get the vaccine, please do think about it. Please check out ivfbabble.com. There's a lot of great information there. We have information on our site, irms.com. Follow me on Instagram, Dr. Serena H Chen. On Instagram and Twitter, I'm trying to put out information as we learn it about the vaccine. So hopefully learn about the vaccine, figure out what your individual pros and cons are, talk to your doctor. In the United States, we are not restricting the vaccine to pregnant women. We're obviously trying to roll it out in stages because of vaccine supply issues, but pregnancy should not be a barrier. Pregnancy itself, or trying to conceive for men or women, or lactation, breastfeeding, should not by itself prevent you from getting the vaccine. You might decide that in your particular situation, you don't want to get it right now. That's okay, but make an informed decision. Talk with your doctor. The benefits of the vaccine seem to dramatically outweigh the risks of getting COVID-19 for most people, including pregnant women. I hope this is helpful to you. Have a great day. Keep wearing your mask, keep washing your hands, and stay safe.